Can joint pain be a sign of inflammation throughout the body, including the brain? In short, yes. Joint pain is often a canary in the coal mine for systemic inflammation. While we used to think of the body and the brain as being separated by a strict wall, the blood brain barrier, we now know that inflammation is a conversation that happens across the entire system. Here is how joint pain, systemic inflammation, and the brain are interconnected. Number one, the systemic nature of inflammation. When you experience joint pain, specifically inflammatory pain like rheumatoid arthritis, rather than mechanical wear and tear, your body is producing proteins called pro-inflammatory cytokines. These cytokines don't stay in the joint, they travel through your bloodstream. High levels of these systemic cytokines can weaken the blood-brain barrier, allowing inflammatory signals to enter the central nervous system. Number two, the joint-brain connection. Neuroscientists have identified a phenomenon where joint inflammation triggers neuroinflammation, that is, inflammation of the brain's immune cells called microglia. This often manifests as sickness behavior, which includes brain fog, difficulty concentrating or feeling spaced out, fatigue, a deep physical exhaustion that sleep doesn't fix, mood changes, increased anxiety or depressive symptoms. Number three, chronic pain as a brain stressor. Chronic joint pain itself is a form of chronic stress. This keeps the body in a fight or flight state, which elevates cortisol. Over time, chronically high cortisol can inhibit the growth of new neurons in the hippocampus, otherwise known as the brain's memory center, further sensitize the brain to pain signals, a process called central sensitization. Is it mechanical or systemic? Not all joint pain means your brain is inflamed. Here are a few things you can ask yourself to distinguish if it's mechanical or systemic. Do you have morning stiffness? It can be mechanical pain if it lasts over 30 minutes or more systemic inflammatory pain if it lasts under 60 minutes. When during activity, if your pain gets worse with movement, that could be mechanical pain, or if it often improves with movement, that's likely systemic inflammatory pain. If you have localized pain in one or two joints only, that's probably mechanical pain. If you suspect your joint pain is part of a larger inflammatory picture, doctors typically look for these biomarkers in blood work. HSCRP, high sensitivity C-reactive protein, a general marker of systemic inflammation. ESR, sedimentation rate, measures how quickly red blood cells sink. Faster rates indicate more inflammation. HbA1c. While it measures blood sugar, chronic high blood sugar is a primary driver of both joint and brain inflammation. The good news, the same interventions that help your joints, anti-inflammatory diets like the Mediterranean or MIND diet, omega-3 fatty acids, and low-impact exercise are the exact same tools used to protect the brain and lower Alzheimer's risk.